how to get a quick fix in the fertility treatments when you just enter into the fertility clinic. First and foremost thing, what you have to remember is there are some three important things what you have to keep in your brain. So by preventing all these things, you can just have a very good fertility outcome. First thing is weight optimization. Weight optimization should be in such a way that for a certain height, you will be having a certain weight limit based on your BMI. Okay, there are some charts which I have put on in my previous videos where you can check it out, where the BMI are being mentioned for the particular height. So ideally speaking, 23 to 25, within that range of BMI would be very ideal. So obesity is the first and foremost factor what you have to keep in brain, where you have to prevent it or correct it before going to a fertility treatment. The next thing is all your basic hormonal checkups, like say thyroids. It can be sugars, thyroids, prolactin levels, and your basic the CBC, whatever it is there. All these things has to be under control. And the next thing, the third thing comes infections. All these infections has to be ruled out and has to be treated. Definitely you have to meet a gynecologist before planning for the fertility. If at all there is a delay in conception, based on your age, it might be 6 months or it can be 1 year post marriage or post planning. So ideally these three important steps is a very important factor. First comes the obesity, second comes the all the basic hormonal profiles, the third comes the infections. Rest of the things, like say major things like say any friend anomalies or any fibroids or adenomyosis or any semen parameter abnormality or consanguineous marriages or all those things in our comes in the very next step. These are the main three basic things what as a patient you have to try to just prevent it, put it into the correct box, and then try for the fertility treatments where the outcomes will be maximum.